of all deaths reported. Now, when we compare with the total number of confirmed cases in 2023, it's more than 600% increase in the cases that have been reported in 2024. Next. Now, looking at the AP week 46, I think we have remained between 2.5 and 3,000 cases, new cases reported a week. In week 46, we had 2,680 new notified cases, of which 492 confirmed cases and 22 new deaths, representing a case fatality rate of 0.8%. And 3 countries accounted for the vast majority of those cases. That's Burundi, DRC, and Uganda. Now, when we look at the confirmed cases, children below 15 years make about 36.8% of cases, and males 48.3% of all cases confirmed. Next. We also look at the percentage of change in confirmed cases in the last 6 AP weeks. I think what we see that there are 6 countries that have experienced an average increase over the last 6 weeks. That's DRC, Burundi, Cameroon, Central African Republic, Liberia, and Uganda. I think the most affected countries that we have right now. And that on average, it's about a 9% increase compared to the 6 AP weeks before the last 6 AP weeks that we are now talking about. Next. Also, we also looked at the distribution of cases by age. Children below 15 years are disproportionately affected in 6 countries. I think this is when we compare the fact that children in Africa make about 40% of the population. And then we looked at countries that do have the proportion of children affected that is above 40%. That is Burundi with almost 43%, Cote d'Ivoire, Central African Republic, Congo, Guinea, and Zimbabwe. Next. We also looked at the situation of contact tracing, which is a key indicator on the quality of surveillance. Now the average stands about 3 contacts identified per confirmed case, yet the target is 20%. Dare to say that this is an area that remains really a considerable challenge for the response. We have in total 36,841 contacts that have been listed from 17 EU member states. We still have also 1 member state that is still not yet reporting contact tracing. I think that is Nigeria. I think just to say that this is one of the priority areas of our support as we move forward. Next. On vaccination, you remember that we had reported earlier that there were 9 countries that were allocated the 899,000 doses of vaccines. Of those, we would like to report today that 8 of them have confirmed their acceptance. We are only left with 1 country, that is Kenya, that is pending. Also, that in the aftermath of the Brazzaville vaccination planning workshop, I think there are already 8 countries that have already submitted their work plan. And in terms of vaccination, there are 3 countries that are vaccinating. That is Rwanda, DRC, and Nigeria. I think in terms of, I think the estimated availability of vaccines, I think we have about 5.6 doses of Mpox vaccines, I think that have been confirmed. And we are also pleased to say that the LC16 has now received the WHO emergency use authorization approval to be used in all ages. Next. Yes, I think that's what I just I say about the LC16. I think that has now been included in the emergency use listing of WHO to be used from age 1 year and above. And now we are just waiting for the confirmation now from the Japanese government when the 3 million doses are going to arrive in the DRC. Next. Now, we had presented before the vaccination coverage in Rwanda, in DRC. I think the last on the list was the province of Kinshasa that has also launched vaccination. I think so far things are progressing very well. They have reached 44% coverage of the initial target, and they are also preparing to move the vaccination into the remaining 16 health zones. Here, we are applying a new strategy, which is the cluster vaccination in hotspot, given the fact that some of the areas, the identification of contacts has remained a challenge. I think entire households are also being considered where there's clear evidence of proximity and increased risk to those around the confirmed case. And we also have to say that we have the ongoing evaluation of the first phase of vaccination in the 6 provinces, which is part of the interaction review, which is taking place between now and December 14th. I think the DRC is also included in the same exercise to also draw lessons from the first phase of implementation to guide what happens in the next phase. Next. Yes, when you look at then the situation, the overall situation in DRC, 45,813 cases that have been notified since the beginning of the year, 9,905 confirmed, 1,153 deaths, with a case fatality rate estimated around 2.5%. But for the week 46, they reported, they notified 2,261 cases. That's about 84% of all the cases that were reported in that week. 205 confirmed cases, that's about 42% of all confirmed cases during the week, and 21 deaths, representing 95% of all deaths during the week. But the distribution by gender, males make 48.8%. By age, children below 15 years make 37%. And the clade is both clade 1 and clade 1B and 1A that are co-circulating. But in terms of lab performance, we are seeing some slight improvement, although still at low level. The testing rate has moved from 18% the previous week to 24.6%, and the positivity rate is also improving from 66 to 87.8%. Next. In Burundi, when you look at the situation over the last 6 weeks, on average, there has been an increase of 13.8% in confirmed cases. And similarly, when we compare week 45 to week 46, we also see an increase again of about 29% in confirmed cases. And during that week, there have been 273 new cases that have been notified, and 187 confirmed cases and 1 death. And you remember that is the first death in Burundi after staying for all that time without any single death reported in the country. Out of the 49 districts, now 44 are affected, have reported at least 1 confirmed case. And the 59.7% of those cases are in Bujumbura City. And within Bujumbura City, Bujumbura North itself accounts for 37% of cases. That means really an outbreak that is concentrated in the capital city. And among the confirmed cases, males make 52.1%, children 42.9%. As you know, Burundi, it is clade B that is circulating. On the lab performance, the testing rate has remained very good, 100%, and the positivity rate stands now at 68.5%. In total, 4,197 cases notified, 2,050 confirmed, one death for a case fatality rate that is estimated at 0.05%. Next. In Liberia, the total number of notified cases since the beginning stands at 332, of which 51 confirmed and 0 deaths. And when we look at the situation over the last 6 weeks on average, I think we see an increase of 102% compared to the previous 6 weeks. And when we look at week 45 compared to week 46, there was also a 16.7% decrease in the number of cases. Now, during the week 46, 17 cases were notified, 10 cases confirmed, and the distribution of those confirmed cases, 58.8% were among males and 39% among children below 15 years of age. And that's already 13 out of the 15 counties in the country that have been affected. On the lab performance, I think the lab testing stands now at 76.5%, and the testing positivity rate at 76.9%. Liberia is experiencing clade 2. Next. And finally, Angola, the last country to report Mpox cases. I think these cases were reported from the 16th of November. And in total, there have been 9 notified cases, 2 confirmed, 0 deaths, and all of them located in Luanda province, which is the capital city. And we are still waiting for more information on travel history to see if these cases are linked to the neighboring DRC. And also the sequencing is still ongoing. I think that's another very important piece of information that we are waiting for. And in response, I think they've identified key areas of support, and we have already deployed also an advanced team. I think that's already in Angola right now, and assisting them already to work on the response plan. I think that is the end of our presentation today. I would like to thank all of you for your attention. Over to you, Director.
Thank you very much, Dr. Ngashi. Unfortunately, the Rwanda Health Minister had to drop off to an emergency. So we'll now move on to questions. I will take the first 2 questions. The first one asks about the recent outbreaks. What do they tell about? Sorry, let me just go again. So what can these recent outbreaks tell us about the vital transmission dynamics and potential pandemic preparedness in resource-limited settings? That's the first question. Let's take the second one. What can we do to support training awareness for clinical staff, community health workers, teachers, and parents? Over to you, Dr. Ngashi.
Yes, Director, can you come again on the questions?
All right. The first question asks about the recent outbreaks, the vital transmission dynamics, and also the potential pandemic preparedness in resource-limited settings. And the second question asks about what we can do to support training awareness for clinical staff, community health workers, teachers, and parents. Those are the first 2 questions, Dr. Ngashi.
Yes, thank you very much, Director. I think there to say that when we look at the transmission dynamics, I think there are considerable lessons that we can learn for our readiness on pandemic preparedness and response on the continent. It is quite heartbreaking to see that after all the major outbreaks that the continent has gone through, went through a major Ebola outbreak in West Africa, We had also outbreaks of Ebola again in the DRC. We went through the COVID-19, and now we are going through Mpox. It is really surprising to see that we always go back to square one. The same challenges persist. We are still struggling with surveillance. You've seen that surveillance, both the active case search, the contact tracing, even surveillance at port of entry, which explains why we see the spillovers of cases in different countries. That tells us that really we are not yet ready when it comes to the level of surveillance that we need for pandemic preparedness. The same, even laboratory, where we had invested so much in laboratory during COVID. You remember that when you look at the testing rate, even the one that I've just presented from DRC now, that we've just moved from 18% to 24%, it tells you that really there's two major weaknesses that we need to focus on to get this continent ready for the next pandemic. I think the main lesson for us is that we need to bid for today and also bid for the future, what we call the resilience, build the resilience of the system, or also ensure that there is some nexus between the emergency response that we are involved in right now. How do we link that to development so that we build in a way that some of this capacity remains to help the continent also with future outbreaks? For us, that is one of the greatest lessons that we've drawn from what we are going through. We've identified some of the priority areas of that resilience. Laboratory is one of them. We really want to make sure that every country at the end of Mpox has got capacity for diagnosis, right from the decentralized level in the district. We can get as a minimum the gen expert machines with cartridges that are able to make the diagnosis. At provincial, regional level, we get the qPCR machines. And then at national level, we get at least the sequencing capacity. We are also doing the same on surveillance. We would like to take advantage of this current investment to digitalize the surveillance system, both at point of entry, but also even at community level and primary healthcare level, so that we can improve the quality of data, but also the promptness with which the data is reported. One of the things that we've also noticed that we have been working with community health workers mainly to support programs. It is clear that community health workers do play a very important role when it comes to emergencies. I think that's the reason why one of the things that we like to work on is to really support countries to ensure that they have very strong community health worker programs that can then also play a role both in development of programs, but also in health security with the prevention and the response to emergencies. I think those are some of the lessons that we are really drawing from this, and that also guide us to work differently from the way that we've responded in the past. On the second question, I think training is critical, is essential. We have the advantage of having some of the key organizations, I think, that have led training those areas, WHO, Africa CDC, all of them working. I think what we are now doing is that we've worked on an integrated training package for different cadres within the health system, for the health professionals, and also for community health workers. Just so to say that one of the initial experiences that we noticed that many of the health workers were not actually aware of Mpox sexually transmitted in the genitals. That when patients were coming, I think that just think about connecting clade 1B with the sexual transmission to look for lesions outside. That's the normal the normal body. To look at also in the genital part or something that was not there. I think that's the reason why I think that work is ongoing to ensure that we have standardized packages for different cadres, of workers that can be deployed to the country, and that is work that is already advanced. Over to you, Director.
Thank you, Dr. Angashi. Let's take the next two questions. Kerry from Health Policy Watch, you have the floor.
Thank you, Margaret. I see that Burundi still doesn't have a plan to roll out vaccinations. So I just wonder, this is week after week, we've seen that. Is there vaccine hesitancy? Does the government not want to accept the vaccines? What exactly is going on? Thank you.
Thank you. Let's take the next one before Dr. Ngashi comes in. Janice from Bloomberg, you have the floor.
Thanks, Margaret. You can hear me?
Yes, we can hear you.
Great. I was just wondering if Africa CDC has any inclination as to when the WHO may say that Mpox is no longer a fake, and what that might mean. We're saying that the global spread is fairly low, but obviously, as highlighted today and every other week, there's still a lot going on within Africa.
Sorry, Janice, let me just stop you there. Your voice is a bit faint. Could you...
Is that any better?
That's better, yes.
Oh, thanks. Sorry. I was just asking if Africa CDC has any sense of when the WHO may decide to say that Mpox is no longer a fake, a global health emergency of international concern, and what that might mean in terms of funding, etc. Obviously, as we've heard today and every other week, there is still a lot going on in the continent, and the cases keep rising, and so I was just wondering, around that. What that might mean and if there was any sense of when that might be.
Thank you. Over to you, Dr. Ngashi.
Yes, thank you very much, Karen, and also thanks to Janice for those very interesting questions. I think if I start with Burundi, the situation in Burundi is that from the partner side, there was a decision to make a conditional allocation of vaccines to Burundi, as we communicated previously, which means that the problem is not really the availability of vaccines. The problem is more on the countryside. We are in discussion with the Burundi government, with the leadership in the country. We've had already some missions to the countries to meet the leadership and have some face-to-face discussions, and we are still continuing. We have already notified, we have people even on the ground right now, and we are just waiting for the yes response from the Burundi government for us to move forward. But you remember that during the COVID-19 time, it was almost a similar experience where there was hesitancy to embrace vaccination, but toward the end of the response, I think the government of Burundi had accepted for the vaccination to be introduced in Burundi. We are hoping that it is the same. At the beginning, I think there was really some hesitation. They just wanted to get more information. That's exactly what we are doing. That information is being provided, to get to the point where we can then convince the government of Burundi to move ahead with vaccines. I think the vaccines are ready. As soon as they accept, we should be able to deploy them. Now, on the issue of the WHO, when is WHO going to declare or to lift up the public health emergency of international concern? The WHO advisory group met, and on Friday, they released their recommendation that there is no evidence that the outbreak is under control for it to be lifted. They encourage the continuity, of the current response. I think they had two major concerns, around the capacity for surveillance, and within that also the capacity to list and monitor the contacts. Just for your information, about 2 weeks, 2 to 3 weeks before that, the emergency consultative group also met in Addis to review also the response and advise the Director General of Africa whether it was time really to also lift up the public health emergency of continental security. The conclusion was the same. that the data so far show that the outbreak remains unabated. I think we still have cases that are on the increase, as I just reported. When you compare the last 6 weeks with the ones before, you see on average there's a 9% increase on the number of cases. That means that there's no reason really to stop. And two, there are major weaknesses in surveillance right now, both on the case finding and also on contact tracing. If you look at some of the data from the DRC, it's like 1 out of 3 cases that come out of the contact list. That means at least 2 out of 3 come outside the contact list, meaning that there's still chains of transmission that are not under the control of the response teams. For that reason, both bodies have recommended that the response that it's not time to do the lifting. Over to you, Director.
Thank you very much. Let's take the next 2 questions. This one asks about the data for Uganda when it comes to children in the last slide that we presented. So the question is, why is there no data for Uganda when it comes to children? The next question is asking about the rising of cases in Burundi and Central Africa. Is there an expectation to have these cases rise during the holiday season in the sense of the number of people traveling to Burundi and Central Africa? So the rise of cases, yes, the rise of cases during the holiday season. Over to you, Dr. Ngashi. Dr. Ngashi, did you hear me?
Yes, thank you very much, Director. I think you're asking a question about the rise of in Burundi and Central Africa during the holiday season. Yeah, I think in both countries, we come to the same denominators. In Burundi, if you look what has happened in Burundi, is that the treatment side has worked so well because the case management is very well organized. But the prevention and the surveillance side have remained the weakest link in both countries. That's the reason why you see the number of cases still on the increase. Now, what happened during the holiday season, there will be need really to intensify both the communication, risk communication and community engagement, to intensify the surveillance, including point of entry, because people will be moving from one place to another. That is that will also facilitate the spread of cases. It will be extremely important also to strengthen the infection prevention and control to make sure that where people are moving, then they can really maintain basic hygienic practices to prevent the spread of the disease because of the increased movement of people from different places. I think, and also given the fact that even those that are in the capital cities, for example, Burundi, where you have people, Bujumbura is the most affected. Usually during holiday season, there are many that also go to the villages and go to other places. It will be extremely important really to strengthen the measures. Otherwise, we'll run the risk of seeing, further increase and further spread of the Mpox outbreak. Also something that the IMST, the way with the member state to make sure that that period is addressed. There's another question before that.
Oh, why children reported cases in Uganda?
Yes.
Or it's about data for you from Uganda. Yeah.
Yes.
Yes, data. I think we didn't present the data from Uganda. I think we received the data, but some of the data is not easy to understand. We felt that we needed to go back to the country and clarify some things. For example, the number of notified cases corresponds to the number of confirmed cases. all the cases that are identified are also confirmed. That's a very unusual situation where you have every single case that meets the case definition is a positive case. Unless those cases come toward the end, when the case is already very advanced to match 100% of every case notified is also a case that is confirmed. It is also the same thing that we saw in the database that was also shared with that we saw that hundred percent positivity rate. It's because of those inconsistencies that we did not want to present that today. But once we have discussed with the country and cleaned up the data, I think next week we'll come back and present the good data from Uganda. Over to you, Director.
Thank you very much, Dr. Ngachi. Let's take the last. Yes, I can hear you.
Director, did you hear me?
Let's take the last two.
Your microphone is muted. I see some questions that are in the chat. I don't know if you can touch on some of those.
Let me take the last two questions. So this question asks about the continent.
There's a question
Dr. Ngachi,
asking about if there's any update for the continental Mpox strategy at the timeline is ending in 6 months.
Yes.
Yes. I realized that we had a network problem because we couldn't hear you. Those two questions are very important questions. I think one is on the continental Mpox strategy. We'd like here to announce that starting from next week we are starting the interaction review of the continental Mpox response. That will be conducted in 2 phases. Phase 1, it is the in-country review in all the 8 countries in category 1. I think that's, our priority countries: DRC, Burundi, Uganda, Kenya, Central African Republic, Uganda, Liberia, and Cote d'Ivoire. No, Nigeria. Those are our 8 countries. In each of those category 1 countries, we'll conduct an interaction review to draw lessons on the first part of the continental plan: what has worked, what did not work, and how can we improve the response in the starting from December up to February. And then that would be 5th and 6th of December. And then the week that follows, we'll all convene in Addis. That means all the countries, all the partners, and all the people needs will convene in Addis from 12th to 14th of December to then put together the country reviews into one continent to review that, to also draw lessons in terms of where have we succeeded, where did we face the challenges, and how do we adjust our strategy moving forward. I think just to reassure that by mid-December, coming out of the inter-response as we move forward. And then the second question is where are we in Mpox? Where are we with Mpox technology transfer? Yeah, I think while Chanel is getting to the things that we had right from the start.
All right, can you hear me, Director?
Yes, we can hear you, Chanel.
Okay, so thank you so much. As Dr. Ngashi mentioned, this is such an important priority for the continent, for Africa CDC, so that we can have the tech transfer and produce an Mpox vaccine on a sustainable basis here on the continent where the demand is highest. Of course, the economics of the tech transfer is going to be determined regarding or primarily based on the estimated demand for the vaccine over time. So we are working with the manufacturers and with partners on what would a steady state demand look like for the vaccine, so that can also influence the sizing of the fill and finish capacity, et cetera. And certainly the incentive to make the tech transfer is influenced by the originator on the number of doses that would be bought. So there's a lot of will, and at this point we really have to work through the economics of it, because there are the right parties involved. And so this next phase, particularly phase 2 of vaccination in the continental plan, is when we would anticipate the technology transfer to materialize. Over.
Thank you, Chanel. Let's take the last 2 questions before we close. This one asks about Africa CDC's perspective on the current trajectory of Mpox spread across the continent. And then the next one asks about the rollout of the children's vaccines. Ngashi, did you hear me?
No, we didn't.
Okay. Let me go again. So the last 2 questions, this one asks about Africa CDC's perspective on the current Mpox spread across the continent. What does the trajectory look like? And then the second one asks about the rollout of children's vaccines expected to begin in the DRC and Eastern Africa. When is this expected? Over to you, Dr. Ngashi.
Yeah. Thank you very much, Director. If I start with the trajectory of the epidemic. I think this is something that has been discussed here with the IMST, but we've also discussed that with the emergency consultative group during the meeting that took place about 3 weeks ago in Addis. What everyone expects is that we still have a couple of weeks, up to 4 weeks, that we can still the continued upward trend while we are trying to tighten the surveillance. But because right now we are deploying 1,000 community health workers to strengthen the surveillance in every single catchment area that has reported a confirmed case, and every district that has also reported a confirmed case, we are also sending epidemiologists that will be seated there to strengthen surveillance. And in every province, we are also bringing IPC specialists as well. I think with this intensification of the response, we are hoping that after about 4 weeks, that can take us until the end of December. Beginning of next year, we should see some plateauing, of the outbreak as a result of all the current investment. And then toward the end of Q1, we can then see the bending of the curve. I think that is the kind of trajectory that we expect, also in consultation with the emergency consultative group that also reviewed the current trajectory of the outbreak. Now, when it comes to children, I think for children, I can say that there's some good news given the fact that Before, we had no single vaccines, I think, for children that was pre-qualified or that had received the emergency use authorization. Now we have MVA that has been approved, pre-qualified, and then we also have the LC16 that has also been also accepted, included in the emergency use list. With that, we've now shifted the work at country level. In DRC, they have already approved also the use of MVA vaccine in children, at least for the 12 to 17. I think it's already approved. With the vaccines that are coming, DRC should be able, if everything goes well, to start vaccinating children, in December. And we are also just following up for LC16 as well, with the Japanese, when they will send the vaccines. If those vaccines can come into the country, we are also hoping that by January, they should be able to also launch the vaccination of children. I think that is for DRC where we have the largest numbers. Now, the other countries, it is work still to continue because we have to work through the NITAGs, because the NITAGs are the one to make recommendation to the Ministry of Health for use of these vaccines in children. Work is going in the other countries, and we don't see really any problem so far with the other countries, except, of course, Burundi, where the negotiations are still on the overall vaccination strategy that is still to be accepted, and then children are part of that. Over to you.
Thank you, Dr. Ngashi. And with that, we have come to the end of the briefing for the week. I will now hand it over to you, Dr. Ngashi, for your closing remarks. Over to you.
Yes, thank you very much, Director. I would like to thank all the participants, first of all, for the continued interest in really getting an update from us on the Mpox response. And just to also reassure that many of these questions also guide our work here. I think that's the reason why we enjoy the moment to really interact and also hear from you. You might not realize that some of the questions that you ask are also triggers, also triggers on our side, whether of the things that we need to consider or the strategies that we need to adapt. You've seen the data shows that we are not yet there. I think that's one of the last questions about the trajectory. The trajectory shows that we are still on the upward trend. We count on all of you really to work together to be able to mobilize all the support I think that we need, and also to spread the news for all those that have the potential to support this response on the continent. We very much appreciate in some of the questions like, what can we do? What can we do to support? I think that there is a question like that is something that we very much appreciate, and that as we move forward, we'd like to continue hearing from you. Do not hesitate. If you have to write to us, we are there to receive your comments, even in writing, or everything that is provided in the chat here, for us to also take that as we move forward. Thank you very much again. We look forward to seeing you in 1 week from now. That is next week, Thursday.
Recording.